Welcome back. We are talking with our Medicare and health insurance experts, Catherine CVA from AARP and Steve Edmonds from Alliance Insurance Services. We are taking your questions right now. You can always get your text question in. All right, I think this is kind of a 2-for-1 with this, Steve. This person's asking, my husband's on SSDI with Medicaid for 2 years. Is he supposed to switch to Medicare after 2 years, and how does he do it? And then this is a very similar question. What if you're disabled and already on Medicare before you turn 65? Do you still need to do something when you're 65?
Okay, so the second question first, if you're on Medicare disability and you're already there, when you get 65, it's still a good thing to check on whatever kind of insurance plan you have, because at age 65, you have an open gateway to the richer Medicare benefit plans like the Medicare supplements. And you can enroll in those with no health questions asked at age 65. But normally people under 65 that's on Social Security disability, they normally have Medicare Advantage plans because they're much cheaper. The coverage is pretty rich and pretty good. So in both of those scenarios, it never hurts to check. You know, if you have an insurance professional that you're working with or somebody that helps you with that, it's always a good idea to check that out, because sometimes you could be eligible for greater or richer benefits. So, and age 65 is always a good time to check, because that's when everybody's eligible for Medicare.
Okay. Catherine, this person says, I'm pretty sure I enrolled. I got my Medicare card in the mail. So does that mean I am enrolled?
Absolutely. And it does mean that when you go to your practitioner, especially that first time, you need to take it in so that they can get your numbers and start using that for billing.
Okay. We want to say that with a caveat. You want to take that into your doctor's office, but Catherine, if someone calls and says, hey, we need to check on your Medicare number or something of that nature?
Do not give it to them. So Medicare will never call you and ask you for that kind of information or your Social Security number. And that's a big source of fraud today.
Okay. Steve, this person says, how much do they take out for the insurance premiums per month?
For Medicare Part A, it's free. There's no charge for it. For Medicare Part B, the charge for that is $174.70 per month. That automatically comes out of your Social Security check each month if you're drawing Social Security. If you're not drawing Social Security, the federal government's going to send you a bill once per quarter for that. So you would have to mail a check in if you're not drawing Social Security on that. So, but $174.70 basically is the amount, unless you're a high income earner, and then you will be hit with an IRMA penalty, or not a penalty, but a charge, and then it can be greater than $174.70, and sometimes a lot greater.
And Steve, if you're a lower income person, you can apply for extra help from Medicare, which is a way to get your premium lowered. So they're going to ask you income questions about that can influence that premium.
And I know this all sounds really complicated, but you know, you can call and talk to an insurance agent with no cost and get them to answer your questions about this so that you know exactly what you're doing and what your coverage is. Really quick, Catherine, this person says, I defer Part B because I still work. Is there a penalty?
There isn't, but there could be if when you quit working, you don't go back in and sign up for Part B within the 10-month window that is there after you quit working.
Okay, so you have 10 months after you quit working to make sure that you go back in there and say, yes, I am taking Part B now. I want to make sure that I'm correct with that. Okay, all right, great. All right, we are taking more of your questions when we come back, and we'll see you in just a few minutes.